Well, while much of the world is focused on coronavirus, there is another illness on the rise here in Canada. Researchers from McMaster University found at least 13 people have had scurvy in the last 9 years. Just in the city of Hamilton, Ontario alone, more than 50 other people had low vitamin C levels. Joining us from Ottawa this morning is the lead author of the study, Dr. Kayla Dagger. Good to have you with us.
Thanks.
This is a disease we associate with like the 15th century or with pirates. How does someone get scurvy?
Yeah, so most of the individuals in our study were individuals who were socially isolated or impoverished and had poor access to fruits and vegetables. But there was also another subset of individuals who suffered from alcohol use disorder. Those individuals don't often consume a lot of fruits and vegetables, which puts them at risk for vitamin deficiencies, and individuals who had undergone bariatric surgery. So in those cases, we're bypassing the digestive tract and they have trouble absorbing nutrients as well.
When you look at the symptoms, which are weakness, anemia, gum disease, skin problems, it's easy to see why perhaps scurvy wouldn't be your first diagnosis.
Yeah, it's a lot of non-specific symptoms, and if as healthcare practitioners we're not thinking about scurvy as a diagnosis, it can be easy to miss, and you really have to take a good history and ask the patient about their nutritional status to consider scurvy and make that diagnosis.
Because it's a disease we haven't talked about in a while, it gives people a reminder. Here's a clear list of some of the symptoms and then what can happen when you have scurvy. You'll experience pain in the limbs, especially in the legs. They might also experience a loss of appetite and weight loss. It can also affect a person's breathing with shortness of breath. And, one of the most common was one of the ones we showed first, which was bleeding in the gums and tooth loss. A person can also experience mood changes like irritability or depression. Are some of those the most common side effects that you'll see in patients?
Yeah, so often we found poor wound healing, easy bruising, gum bleeding, and skin changes. But because scurvy is not well, understood or thought of by a lot of health practitioners, there wasn't clear documentation of a lot of the symptoms in the charts that we reviewed, unfortunately.
Well, it's hard to think that all of those things would relate to one another with a diagnosis like scurvy. Few parents are wondering about kids who are picky eaters. They refuse to have their fruits and vegetables. Can a multivitamin help? Is it enough?
Yeah, so multivitamins could be helpful. I would hope that people would be having fruits and vegetables in their diet that would help prevent scurvy. It really takes very little, about 10 milligrams of vitamin C per day, and an orange has about 5 times that amount. So if you're really having a varied diet of any sort, you shouldn't develop scurvy.
Dr. Kayla Dagger, thanks for joining us today.
Thanks for having me.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.